Welcome to the PAH Today National Broadcast Series. My name is Dr. Lana Melendres-Groves, and I'm the Medical Director for the Pulmonary Hypertension Program at the University of New Mexico. I'm really excited today to talk about the power of movement. Specifically, we'll be talking a lot about cardiopulmonary rehabilitation for PAH. This is really just talking about how movement and exercise can help people with PAH. Let me provide the following disclaimer. This presentation is sponsored by and made on behalf of United Therapeutics. Healthcare professional speakers are compensated by UT. This presentation is for educational purposes and is not a substitution for your doctor's advice. Note that not all exercise programs are appropriate for all patients, so please talk to your doctor before starting any exercise program. Let's get into what we're going to learn today, or at least what I hope to teach. This program is really designed to help you in 5 different ways. The first, understand the impact of PAH on the heart and lungs and how that leads to the symptoms that you may feel. Second, recognize the importance of movement and exercise in managing PAH. Third, overcome hurdles to include movement and exercise into your routine. Fourth, let's learn about cardiopulmonary rehabilitation, how to get started, and how it might be adapted to fit your specific needs. And last, we're going to talk a bit about mental health and the benefits of movement and exercise in PAH. I know that if you've been part of these national broadcast series in the past, you may remember that we've talked a lot about what causes pulmonary arterial hypertension. Today, we're going to take a little bit of a different view, not just what causes PAH, but how those changes can lead to the symptoms that you feel. You can see that there's a picture on the screen, and on each side are comparing the blood vessel of somebody who does not have PAH to the blood vessel in the lungs of somebody who does. You can see on the left that blood vessel is free flowing of blood and it is wide open, no barriers, and that allows for normal blood flow and normal pressures within the blood vessel. When people develop PAH, they find that those blood vessels start to narrow and start to thicken, and that makes it much more difficult for blood to flow easily through those narrowed blood vessels. This results in higher pressure within the blood vessel and reduces the blood flow to the lungs. Long term, that can affect the way the heart works and in turn impact how you feel. So let's talk a little bit about that connection of your symptoms to the heart and lung. Well, in the lungs, when you have less blood flow, less oxygen is able to be absorbed, and therefore less oxygen is getting out to those important parts of your body. It's reducing the blood flow into the lungs and therefore reducing the oxygen to the rest of the tissues and organs. This may result in you feeling more short of breath. When it comes to the heart, often the heart is having to work harder to push that blood through those narrowed blood vessels. This can result in heart strain, and often people may feel more fatigued or they may even get lightheaded. So why does movement and exercise matter in PAH? Well, many PAH patients, and I would say probably all patients, want to feel like themselves again. They want to be able to do more, walk further, be able to maintain their daily activities with more ease. As PAH progresses, you may feel that you move less because of your symptoms, and that those limitations then increase the fear of movement, which then decreases, once again, how much you move. Moving less can contribute to a cycle of decreasing endurance and a decline in how you feel. I know some people would say, movement is not for me. Movement is for everyone, including you. And more importantly, movement is essential for our patients with PAH. Sometimes it takes sort of an approach to movement that allows you to really engage. And I think understanding why movement is important may help. It can be beneficial because it can really improve overall your exercise capabilities and what you can do. You really should explore different forms of movement and exercise. For instance, there was a study looking at yoga in PAH patients across all different ability levels. And what the participants reported was that they felt an improved physical well-being after partaking in that study and doing the yoga. They also had an enhanced emotional health sense for themselves. It really is important that you talk to your doctor or your provider about some guidance when it comes to your movement and your PAH, because every person is different and is affected differently by their disease. And it's important so that you are able to get started at the ability level that you are. So what's stopping you? Well, I am sure that all of us could come up with a million different reasons that today isn't the day. Some of those common hurdles include, I just don't know how to get started, right? We see things on our phones and on the TV and everywhere. We're inundated with all of the stuff that we should be doing, but it's hard to know which of those is most appropriate. Another issue is lack of time. I'm sure that between potentially doctor's appointments, family commitments, other stressors, other obligations, that it feels like trying to carve out a piece of time each day or every couple of days would be impossible. Sometimes we just can't get into a routine, and being able to find a way is almost impossible feeling. I know that here in New Mexico, our spring weather, winter weather, summer weather, it all plays into what I might be able to do outside. That may be the case for you. And so trying to find different ways to be able to get involved in more movement and exercise. Maybe that means that today's not the day to go outside, but maybe I can do something inside. But that then plays into maybe I don't have the space to do it. How can I use what I have? And that, again, is why each person is so individual in their journey. One that I do want to make very specific note of is a sense that many of my patients have about feeling worried about overdoing it, and that maybe they could make themselves worse or put themselves in harm's way. So we're going to talk a little bit about how we may be able to overcome some of these hurdles, and it's specifically with utilizing exercise guidance and or supervision to help address those things. This is where Cardiopulmonary Rehabilitation, which is a tremendously long word to just say, how do we help you exercise better for your heart and lungs? Well, it's a supervised program. We often shorten it to cardiac rehab or pulm rehab. And what it includes is a very specialized individual who is educated, whether that be a physical therapist or a respiratory therapist or an occupational therapist or somebody else who really understands chronic lung disease and heart conditions like PAH. And because of that understanding, they're able to then create a program for you specifically to be able to follow. Some of those movements and exercise that they may be talking about might include lightweight training, or specifically breathing exercises. They may include some aerobic exercises, or maybe they're just going to ask you to do some walking. Additionally, we have learned a lot more about yoga, as I've mentioned previously. And we even know now that there are opportunities for things like chair yoga for our patients that really aren't able to get up and down very easily. Having these discussions and having the supervision to be able to build on these programs and create new habits is going to be essential to getting you toward the goals of improved quality of life. So that means we have to embrace movement. We need to stay safe, but we want those health benefits. In multiple studies, patients who participated in supervised movement or pulm rehab experienced this feeling that their heart was pumping blood more easily through their lungs, that there was an ability to walk further or exercise longer. Let's talk a little bit about opportunities for this type of program and movement even at home, and how those positive benefits can affect patients with PAH. So some of those positive effects on the symptoms are really kind of guiding the path of our patient. As they start to have improvement in terms of their muscle strength and become more active, they start to see that their goals may change. They may have more opportunity to engage in their daily lives. We also are looking to improve people's energy level, to decrease that fatigue that they often experience. I know that it seems overwhelming at times, but we're looking for very small steps along the way. Each day, a little bit of movement to help you feel stronger and more energized. We talked about some of the hurdles within ourselves, but there are other hurdles that often come up when we talk about navigating access to cardiopulmonary rehab. This is where discussing with your specialists and your providers can be important. One, they may be well versed in what is out there in your community and helping to locate a place that you would be able to participate in some of that rehab. Or maybe you need to have a completely remote type program created because you live in an area, and I'm in New Mexico, so many of my patients may live quite a distance from my center, and I still want to be able to give them opportunities to increase movement. Sometimes that may mean a hybrid program where they come in for those first couple of times to get a sense of what is needed and then be able to take that back into their local community. So please ask your doctor about what pulmonary rehab options may be available to you and which may be most appropriate. I made note of it earlier about overdoing it and that sense of dread and worry that you could do something that could harm yourself. This is where having a monitored program can become so important just to help you overcome that anxiety and worry. Those individuals will be tracking your vital signs such as your blood pressure and your heart rate and your oxygenation, and being able to tell you at what point we should slow down or what point you might be able to continue to move forward. They will help to assist in safely building that endurance and helping to set those safe exercise limits. Just remember, your concerns count. For instance, often you can feel when your heart is racing and going so fast, and being able to talk to the provider that is working with you about that and what that might mean. Many of my patients are on oxygen or need oxygen with exercise, and there can be a lot of anxiety associated with that. We have seen that in one of our studies of our PAH and PH patients that they had improvement in the need for oxygen when they started to participate in these types of programs. I can't promise that that will happen for everybody, but we start to see those improvements not just in fatigue, but possibly oxygenation and endurance and strength and overall quality of life. One other aspect that we don't talk enough about, and so I'm always happy to chime in on this, is about mental health. Our mental health is key to our success in anything that we do. We have seen that there are tremendous benefits from movement and exercise when it comes to mental health in our patients with PAH. They often find that they have fewer depressive symptoms throughout their journey. A study of cardiac patients showed that exercise rehab programs improved mental health, including anxiety, depression, and there were additional gains in physical quality of life. Some of the studies have shown that breathing exercises can reduce stress, anxiety, and the feelings of depression in our cardiac patients. There are a few of the quotes on the screen that talk about our PAH initiative patient ambassadors and what they have to say about pulmonary rehab. I hope that you're able to read all of them. I'm going to just pick out two that I really appreciate. One of those is our ambassador that says, "I really enjoyed rehab. It helped me with my breathing. All the exercises were hard at first, but it got easier by the end." Another individual said, "Not only did the cardiopulmonary rehab help with exercises, but they also had someone talk to us after our workout about different things to do. We had a nutrition specialist who came and taught us how to eat, and a yoga instructor, and we learned about medical insurance." Some of the key questions that you should be asking your physician, your provider, are what types of movements and exercises are best in my circumstances. Also, what are my options for supervised exercise and pulmonary rehab? I think this one is a really key question. How can we monitor my progress? Well, I think each of us probably monitor slightly differently. Our patients, my patients, probably think progress is based off of symptoms and how I feel. I agree with that. I think you're going to look internally as to how you are doing. But when you come to the actual rehab program, they keep a journal of your journey, and you're able to then look back and see how far you've come through that time period. For me as the provider, often I'm looking at a 6-minute walk distance or what you're telling me you can do in terms of your daily activities that helps to assess what your progress has been. Another aspect is often how often and intensely should I exercise. This is where I really talk to my patients about listening to what their body says, what their life allows them to include, and at the end of it, it really should be tailored to you individually. So talk to your doctor about an exercise plan that supports both your mind and your body. I really want you to feel as though you can take an active role in your treatment. So following a treatment plan and considering how you need to adjust based off of where you are today and where you would like to get to in the future. Make sure to keep track of your symptoms. Share those updates with your doctor. I really think it's important that my patients just think about what types of foods they're putting into their body every day. I'm not going to say that we all shouldn't try to engage with our foods. It's part of our enjoyment in life. But if we're really thoughtful about what we're eating, when we're eating it, and in the quantities that we're eating it, that can really help long term when we're talking about PAH and heart failure. We need to continue to manage mental health through stress-relieving activities and relaxation techniques. Make sure you get enough sleep. I don't know that any of us feel we get enough sleep. We constantly feel tired, but this is key. This is the time that your body is repairing itself. It's recuperating. It needs that sleep to be able to do so. If you're having difficulties with sleep, please talk to your providers because there may be things that we can discuss and opportunities to improve that. I think that the entirety of this program has really been about talking about movement, asking your provider about how you might do that and how it would be right for you. I want to provide another insight into some opportunities that might work for you. These are 6-minute fitness videos from the PAH initiative that are designed for people with PAH. You can use the QR code and go to the website for the PAH initiative. Check out those videos and see if those might be something that you would be interested in utilizing, or maybe you might provide it to somebody that you're caring for. Let's go through a quick recap about empowering your PAH self-care. We talked about 5 of them. The first, movement is a powerful tool in managing PAH. Second, exercise, even at home, may lead to significant benefits. Third, adding exercise to a treatment plan may help you feel better and track more closely with the goals you're setting for yourself. Fourth, supervised exercise or pulm rehab may help overcome the barriers preventing you from getting active again. And last, talk to your doctor before starting a movement and exercise routine. We need to help you find what works best for you as an individual so that you can continue to engage in your story. You're still writing that story. That's where considering how movement and exercise play into it and how that may empower you, and it is within reach, is so essential to understand. Ask your PAH specialist if supervised exercise and pulm rehab is an option. Make a plan. Follow that plan. And then celebrate every achievement, no matter how small. Because really, if we add up all the small achievements and gains, those lead to great changes that can help benefit you in the long run. Let me just say thank you. Thank you for engaging. Thank you for being present. Thank you for working to learn more about PAH and how there are opportunities that you can continue to rewrite and write your story to the future. For more information, visit www.pahinitiative.com. You can also use the QR code on the screen, and please feel free to connect with us on social media. Thanks.